Hi everybody, this video of mine is about conjunctivitis. But before I discuss conjunctivitis, let me tell you about conjunctiva. This is the clear thin membrane that covers part of the front surface of the eye and the inner surface of the eyelids. It has two segments. The first segment is bulbar conjunctiva. This portion of the conjunctiva covers the entire part of the sclera, that is the white of the eye. The bulbar conjunctiva stops at the junction between the sclera and cornea. It does not cover the cornea. The second is palpebral conjunctiva. This portion covers the inner surface of both the upper and lower eyelids. There is another term for the palpebral conjunctiva, that is known as tarsal conjunctiva. The bulbar and palpebral conjunctiva are continuous. This feature makes it impossible for a contact lens or anything else to get lost behind your eye. Now let's start with the main topic, that is conjunctivitis. Well, conjunctivitis is also known as pink eye. This is an inflammation or infection of the transparent membrane that lines your eyelid and covers the white part of your eyeball. When small blood vessels in the conjunctiva become inflamed, they are more visible, as you can see in the picture. This is what causes the whites of your eyes to appear reddish or pink. Pink eye is commonly caused by bacterial or viral infections or an allergic reaction, or in babies an incompletely open tear duct. Though pink eye can be irritating, it rarely affects your vision. Treatment can help ease the discomfort of pink eye because pink eye can be contagious. Early diagnosis and treatment can help limit its spread. Now let me tell you the symptoms. The most common pink eye symptoms include redness in one or both eyes, itchiness in one or both eyes, a gritty feeling in one or both eyes, a discharge in one or both eyes that forms a crust during the night that may prevent your eye or eyes from opening in the morning, and lastly there could be tearing. Okay. And there are serious eye conditions that can cause eye redness. These conditions may cause eye pain, a feeling that something is stuck in your eyes, foreign body sensation, and blurred vision and light sensitivity. If you experience these symptoms, seek urgent care. I mean to say, there are some other conditions like glaucoma, which can be dangerous. The form of glaucoma which is dangerous is acute congestive glaucoma. So do not mix conjunctivitis with that glaucoma, because that's a serious condition, and the symptom which I told you. I mean, if you are suffering from eye pain, a foreign body sensation, blurred vision and light sensitivity, then you should seek the help of doctor immediately. People who wear contact lenses need to stop wearing their contacts as soon as pink eye symptoms begin. If your symptoms do not start to get better within 12 to 24 hours, you should make an appointment with your doctor to make sure you don't have a more serious eye infection related to contact lens use. Coming to the causes of conjunctivitis, the causes of pink eye include viruses, bacteria, allergies, a chemical splash in the eye, a foreign object in the eye, a newborn, a blocked tear duct. Now let me discuss viral and bacterial conjunctivitis. Most cases of pink eye are caused by a virus. Both viral and bacterial conjunctivitis can occur along with colds or symptoms of a respiratory infection such as sore throat. Wearing contact lenses that are not cleaned properly, or are not your own cause bacterial conjunctivitis. Both types are very contagious. They are spread through direct or indirect contact with the liquid that drains from the eye of someone who is infected. One or both eyes may be affected. Now let me tell you about allergic conjunctivitis. Allergic conjunctivitis affects both eyes, and it's a response to an allergy causing substance such as pollen. In response to allergen, your body produces an antibody called immunoglobulin E, that is also known as IgE in short form. This antibody triggers special cells called mast cells in the mucous lining of your eyes and airways to release inflammatory substances including histamines. Your body's release of histamine can produce a number of allergy signs and symptoms, including red or pink eyes. If you have allergic conjunctivitis, you may experience intense itching, tearing and inflammation of the eyes, as well as sneezing and watery nasal discharge. Most allergic conjunctivitis can be controlled with allergy eye drops. Also, there is a conjunctivitis that can result from irritation. Irritation from a chemical splash or foreign object in your eye is also associated with conjunctivitis. Sometimes flushing and cleaning the eye to rid it of the chemical or object causes redness and irritations. Signs and symptoms, which may include watery eyes and a mucus discharge, usually clears up on their own within about a day. If initial flushing does not resolve the symptom, or if the chemical is a caustic one such as lye, you need to be seen by your doctor or eye specialist as soon as possible. A chemical splash into the eye can cause permanent eye damage. Persistent symptoms could also indicate that you still have the foreign body in your eye, or possibly a scratch over the cornea or the covering of the eyeball, that is sclera. Now here are the risk factors of the pink eye that include exposure to something for which you have an allergy, that is allergic conjunctivitis, exposure to someone infected with a viral or bacterial form of conjunctivitis, using contact lenses, especially extended wear lenses. Now let me tell you the complications. In both children and adults, pink eye can cause inflammation in the cornea that can affect vision. Prompt evaluation and treatment by your doctor for eye pain, a feeling that something is stuck in your eye, that is foreign body sensation. Blurred vision or light sensitivity can reduce the risk of complications. As I told you, there are other symptoms which can affect your eye, which could be dangerous. So in that case, the symptom which I told you earlier, you should seek urgent attention of the doctors. Okay, now let me tell you the preventive measures. You should practice good hygiene to control the spread of pink eye. For instance, do not touch your eyes with your hands. Wash your hands often. Use a clean towel and washcloth daily. Do not share towels or washcloths. Change your pillowcases often. Throw away your eye cosmetics such as mascara. Do not share eye cosmetics or personal eye care items. Keep in mind that pink eye is no more contagious than the common cold. It is okay to return to work, school or childcare if you are not able to take time off. Just stay consistent in practicing good hygiene. Now let me tell you a little bit of prevention of pink eye in newborns. Newborns' eyes are susceptible to bacteria normally present in the mother's birth canal. These bacteria cause no symptoms in the mother. In rare cases, these bacteria can cause infants to develop a serious form of conjunctivitis known as ophthalmia neonatorum, which needs treatment without delay to preserve sight. That is why shortly after birth, an antibiotic ointment is applied to every newborn's eye. The ointment helps prevent eye infection. Now let me tell you about the diagnosis and treatment. In most cases, your doctor can diagnose pink eye by asking questions about your symptom and recent health history. An office visit is usually not needed. Rarely, your doctor may take a sample of the liquid that drains from your eye for laboratory analysis, that is for the culture. A culture may be needed if your symptoms are severe or if your doctor suspects a high-risk cause such as foreign body in your eye, a serious bacterial infection, or a sexually transmitted infection. Now let me tell you the treatment. Pink eye treatment is usually focused on symptoms relief. The doctor may recommend using artificial tears, clearing your eyes with a wet cloth, and applying cold or warm compresses several times daily. If you wear contact lenses, you will be advised to stop wearing them until treatment is complete. Your doctor will likely recommend that you throw out contacts you have worn if your lenses are disposable. Disinfect hard lenses overnight before you reuse them. You should ask your doctor if you should discard and replace your contact lenses and lens accessories such as the lens case used before or during the illness. Also replace an eye makeup used before your illness. In most cases, you won't need antibiotic eye drops. Since conjunctivitis is usually viral, antibiotics won't help and may even cause harm by reducing their effectiveness in the future or causing a medication reaction instead. Instead, the virus needs time to run its course, up to 2 or 3 weeks. Viral conjunctivitis often begins in one eye and then infects the other eye within a few days. Your signs and symptoms should gradually clear on their own. Antiviral medication may be an option if your doctor determines that your viral conjunctivitis is caused by the herpes simplex virus. Now let me tell you the treatment of allergic conjunctivitis. If the irritation is allergic conjunctivitis, your doctor may prescribe one of many different types of eye drops for people with allergies. These may include medications that help control allergic reactions such as antihistamine and mast cell stabilizer, or drugs that help control inflammation such as decongestants, steroids, and anti-inflammatory drops. Over-the-counter eye drops that contain antihistamine and anti-inflammatory medication also may be effective. You should ask your doctor if you are not sure which product to use. You may also reduce the severity of your allergic conjunctivitis symptom by avoiding whatever causes your allergies when possible. Now let me tell you some of the lifestyles and home remedies to help you cope with the signs and symptoms of pink eye until it goes away. You should try by applying a compress to your eyes. To make a compress, soak a clean lint-free cloth in water and wring it out before applying it gently to your closed eyelids. Generally, a cool water compress will feel the most soothing, but you can also use a warm compress if that feels better to you. If pink eye affects only one eye, do not touch both eyes with the same cloth. This reduces the risk of spreading pink eye from one eye to the other. Also, you can try eye drops. Over-the-counter eye drops called artificial tears may relieve symptoms. Some eye drops contain antihistamines or other medications that can be helpful for people with allergic conjunctivitis. Also, you should stop wearing contact lenses. If you wear contact lenses, you may need to stop wearing them until your eyes feel better. How long you will need to go without contact lenses depends upon what is causing your conjunctivitis. You should ask your doctor whether you should throw away your disposable contacts as well as your cleaning solution and lens case. If your lenses are not disposable, clean them thoroughly before reusing them. Now let me tell you the summary of the prevention tips once again. First of all, never share your personal items such as washcloths, hand towels, or tissues. You should cover your nose and mouth when coughing or sneezing. You should avoid rubbing or touching your eyes. You should wash your hands frequently, especially when spending time at school or in other public places. You keep a hand sanitizer nearby and use it frequently. Frequently clean surfaces such as countertops, bathroom surfaces, washer handles, and shared phone with an antiseptic cleaner. If you know you suffer from seasonal allergy, you should ask your doctor what can be done to minimize your symptoms before they begin. If you wear contact lenses, follow your eye doctor's instruction for lens care and replacement, and use contact lens solution properly, or consider switching to daily disposable contact lenses. While swimming, you should wear swim goggles to protect yourself from bacteria and other microorganisms in the water that can cause conjunctivitis. Before showering, remove your contact lenses to avoid trapping bacteria between your eyes and the lenses. I hope you like this video of mine. If you are concerned about conjunctivitis, or if you have any other illness, or if you want to ask any other issue, please post your comments in the comment section of this video. And if you have not subscribed my channel till now, please subscribe this channel so that all upcoming videos are delivered to your inbox straight away by pressing the bell icon and selecting all options. Okay. And if you think that my videos provide some sort of benefit to you, please like this video and share this video with your families and friends and through social media. Thank you very much. See you in next video. Bye.